Mr. Speaker, on behalf of the families with children with complex medical needs all across America, I rise to urge approval of the IMPROVE Act, which includes a bill that I've been working on for a number of years with Representative Joe Barton called the ACE Kids Act. We drafted the Advancing Care for Exceptional Kids Act a few years ago with the simple but important goal of putting families and children first. The bill authorizes the creation of cost-saving and time-saving health homes where specialized care is coordinated in a high-quality setting. Mr. Speaker, the children with complex medical conditions and their families are heroic. Caroline West in Tampa, Florida, has a rare genetic condition, also cerebral palsy and a seizure disorder. She can't walk. It's very difficult for her to speak, but she's able to attend school part-time and enjoys the life of a typical teenager in many respects. Lucy Ferlita is the only living person in the United States with early onset myopathy with arflexia, respiratory distress, and dysphagia. Very little is known about this disease, but what we know is that it's very difficult for her to eat. She has to have a feeding tube, a ventilator to breathe, and nursing care 24 hours a day, and yet she's a bright and social 6-year-old. Jaden Velasquez has a congenital heart defect. He was born with it. The left side of his heart is severely underdeveloped. He's undergone numerous surgeries, but yet he's a loving and happy 10-year-old, loves swimming, and is enjoying life. Lakota Lockhart, another congenital central hypoventilation syndrome, central nervous system disorder. It causes him to not be able to breathe every time he tries to sleep. I met these children in Tampa, Florida at the St. Joseph's Children's Hospital. They have a world-renowned chronic complex clinic that was started 16 years ago by a passionate pediatric doctor named Dr. Daniel Placencia. The ACE Kids Act is modeled after the work being done at St. Joe's by the professionals at the Chronic Complex Clinic and the 700 kids and families they currently serve, and other children's hospitals all across the country. The families have shared with us how difficult it is to get quality health care. It's oftentimes so fragmented and uncoordinated. They have to go from one office to another. Maybe the specialist is in another state. That's why we put together the ACE Kids Act to help coordinate care in a single setting to help give these kids a better quality of life. And the ACE Kids Act will do just that. The bill provides an incentive to states to establish health homes to better coordinate care for kids with medical complexities. It also directs HHS to provide guidance to states on best practices relating to providing care across state lines. As so many of these families know all too well, coordinating care across a state line can be burdensome. So that's the aim of the ACE Kids Act, to lift that burden. In addition to Congressman Joe Barton, who has worked diligently for so many years to get this over the finish line, I want to thank all of the families with children with complex medical challenges. They deserve credit for moving this bill forward, coming to Congress and helping to explain the importance of coordinating care. I also want to thank Chairman Walden, Ranking Member Pallone, Chairman Burgess, and Ranking Member Green for your support, and our stalwart partners, Representatives Herrera-Butler, Eshoo, and Reichert. Thank you to America's Children's Hospitals, the March of Dimes, the American Academy of Pediatrics, and thanks to the professional staff at the committee for your dedication to these families, especially Rachel Pryor, Samantha Satchel, Tiffany Garasco, Josh Trent, Caleb Graff on the Republican side. Additionally, this bill would not be where it is without the stellar work of Representative Barton's staffers, Krista Rosenthal, Gable Brady, Sophie Traynor, and Jeannie Bender, and my LD, Elizabeth Brown. Passage of this bill will be a gift to so many families during this holiday season and beyond. So I urge my colleagues here in the House and then over in the Senate to pass the ACE Kids Act.